Animal Humane Society utilizes portable Progeny Radiograph machines to take X-ray images to aid in dental procedures. In this video, you will learn how to set up these machines, take the images, and log the number of radiographic images taken during each session. When you are ready to set up the machine, first lock the wheels in place so it does not roll around, and plug in the machine. With the wheels locked and the machine plugged in, flip the switch on the bottom panel to the on position. When the machine is turned on, the display panel will light up. The only setting you need to select on the machine panel is the size of animal, large dog or small dog/cat. Push the button to change between settings, and you will notice that the exposure time will change between 0.064 and 0.080. The other settings should not need to be changed from 65 kV and 7 mA. Next, you will plug in and log into the attached laptop. After you are logged in, open and log into Progeny, which should be linked on the desktop. Once logged into Progeny, prepare the sensor, which should be stored in a protective case. The sensor is sensitive, so it is important to handle it with care and to store it properly when it is not in use so it does not get damaged. To prepare the sensor, slide a protective sleeve over it. You may use the sensor this way, or you may prefer to wrap the sensor in vet wrap for added grip within the mouth. Tiffany prefers to use vet wrap, so she is demonstrating how to wrap it here. If you use vet wrap, it is important to keep the flat side of the sensor as flat as possible and free from folds and wrinkles caused by the vet wrap. The flat side of the sensor is the side that takes the image. If there are folds or wrinkles within the vet wrap, you may get false images. It is important to change the sleeve and the vet wrap between patients to prevent bacteria and other germs from spreading between patients. Once the sensor is prepared, plug it into the port on the arm of the machine and place it safely so it does not fall. When the sensor is plugged in, you should notice the software now is ready with a green notification at the top of the screen. The next step is to set up patient information in the software, enter patient name, age, animal ID number, and species. With these steps complete, the machine is now ready for use.
What I'm going to do first is, you see on here, I'm going to select the teeth that I'm going to take a picture of. So I'm starting on the 200 side, so I'm going to start as far back on the upper arcade as I can and go as far forward as I can. So I'm going to select and then drag the teeth I'm going to try to take. And then release them. So I'm going to take a photo of those teeth. And then to actually take the photo, I need to hit this little beach ball looking radiation symbol here. And then when it's red, it's ready to take a shot. So then we have to get this probe in position first. So I'm going to try to take, those teeth correlate with these teeth up here. Okay, so I got to stick this probe in flat side up because I'm going to take those upper teeth. I need to get this as far back in the mouth as I can. And I'm aligning the side of that probe up with those tip of those teeth because it's the roots that I'm really trying to get. So now I can't just take it straight down because then I'm just going to get all the way through those teeth, right? So I'm going to have to take this at an angle. To get the proper angle, it's this plate that you want to get that proper angle with. So if you're aiming for a 45 angle, it's a 45 angle to the plate. If you're aiming for a 60-degree angle, it's to this plate. So unless the animal is completely parallel with your surface, like your table, then that would be your 0, but that's often not the case. So wherever that plate is in the mouth, that's your 0. So you need to use that as your plane of reference. Set my angle to try to get that image. So I usually have to shoot through the eye on these upper teeth up here. So if you think that plate is sitting like this, right? So look at where my beam is. I'm hitting that beam like about this, and that's about 45, right? So you have to do some math in your head. You know, you got to look at the angle of that plate, and then how that beam, so the beam's going to be coming out here, is going to hit that plate. And you're aiming for usually around 30 to 45. Depending on the teeth you're taking shots of. So you gotta aim it at that plate at about a 45-degree angle to try to get, the image that you're looking for. Line it up So you know you're lined up on the plate here, you're lined up on the plate here. I'm going to take this image from way over here, okay? After you take the image, it shows up here. So see how I got all those roots? And then you put it in here at the end of the day. So you got this dental log, and then so you track date, the number of x-rays you took, patient, whether you just took a couple teeth and which teeth or full mouth. And then the settings, like I said, always stay the same, but you might need to write, okay, we took however many retakes due to either, usually it's not exposure because I said these don't change. And then it's like I said, it's almost always position. And then who was doing the x-rays that day.